What do herpes symptoms look like? Herpes symptoms can be quite varied and sometimes tricky to spot because many people have mild or no symptoms at all. When symptoms do appear, they usually happen within 2 days to 2 weeks after exposure to the virus. The first signs often include sensations like itching, tingling, or burning near the area where the virus entered the body, which could be the genitals, mouth, or surrounding skin. These early feelings are often followed by flu-like symptoms such as fever, headache, muscle aches, swollen lymph nodes, and general body discomfort. Women might notice additional symptoms like pain in the legs or vaginal area, difficulty or pain during urination, changes in vaginal discharge, or a feeling of pressure in the lower abdomen. Soon after these initial signs, painful small blisters or sores tend to develop. These blisters are usually about the size of a pea or smaller and may be grouped together. They often break open, releasing clear or slightly cloudy fluid, and then crust over as they heal. These sores most commonly appear on or around the genitals, anus, mouth, lips, cervix, or thighs, depending on where the infection is located. The initial outbreak can be quite uncomfortable, with soreness and pain that may last for several days to a couple of weeks. After the first outbreak, herpes can come back in episodes called recurrences. These tend to be milder and shorter than the initial outbreak. During recurrences, you might notice similar sensations like tingling, itching, or burning before sores appear. The sores themselves are often smaller and less painful, and they tend to heal faster. Some people experience frequent outbreaks, while others might have only 1 or 2 in their lifetime. Common triggers for recurrences include stress, illness, exposure to sunlight, fatigue, or skin irritation. An important aspect of herpes is that the virus can be transmitted even when no sores or symptoms are visible. This is called asymptomatic viral shedding, which means the virus can spread without any noticeable signs. That's why it's possible to transmit herpes even if you feel perfectly fine. Recognizing herpes symptoms is key to early diagnosis and management. Because symptoms can resemble other skin conditions like pimples or ingrown hairs, medical testing is often necessary. Doctors can swab sores to detect the virus directly or perform blood tests to identify herpes antibodies when no sores are present. Remember, herpes is a lifelong infection with no cure, but antiviral medications can help reduce the severity and frequency of outbreaks and lower the risk of transmission. If you notice any symptoms or think you might have been exposed, it's important to see a healthcare provider for proper testing and personalized advice.